All right. Well, we are at the end of this hybrid portion of our forum. And so I wanted to highlight the next steps of what Chosen Quick is either actively engaged in or considering for the near future. One thing that's been apparent, I think, to all of you is that we have shifted from opioid exposed newborn care to substance exposed newborn care. I think we've now heard repeatedly that at birthing facilities, while opioid use disorders are still highly prevalent, it is not the majority of the cases, patients, infants that you are seeing that are affected. That in fact, it's other substances like amphetamines in particular. And so our data system has been adapted to capture this larger group of substance exposed newborns. And I absolutely recognize that marijuana is complicating all of this. That for some facilities, the bandwidth to input every pregnant individual who is using marijuana during pregnancy into this data system is too much of a data burden. I don't have an easy solution except that if you choose to not, that if you can make note of that or just inform us so that we can best analyze your data in a way that's most helpful to you. Prenatal engagements, as you saw when I started the day off, our prenatal engagements consultation rates are extremely low. And truly, the hope is that the work that you've heard about from Dr. Wells, Dr. Halmo, as well as from Katie Breen, will lead to better engagement early in pregnancy. And then transition home. You know, our early intervention referral rates within Chosen are getting better, but still far from optimal. We learned a lot about EI today, lots of changes that are happening. Our hope is that truly referral is embedded in the discharge process for our substance exposed newborns. I think importantly, we are so excited about piloting the plans of safe care, you know, really operationalizing it and thinking about it as a living document, not as a burden upon birthing hospital providers that needs to be completed by discharge, but truly as not even a document, but really as a plan, as a family support plan that starts as early as possible in pregnancy, that is owned by the family and then carried forth, you know, through pregnancy, the birth hospitalization, and then years postpartum. The engagement with outpatient providers continues to be, I would say, I was going to say a barrier, but an opportunity for improvement. And as you heard from Lyle, the KICS clinic, I am so excited about this. So it's being led by Dr. Bird Gilmartin. It will be a clinic that is focused on the care of children in the foster care system. We are starting a pilot where infants who are eligible, so who are not going home to biologic parents being discharged from the university hospital, will be referred to this clinic. And it's a multidisciplinary co-located model of care where there's general pediatric care, there's behavioral support, developmental assessment, and even dental care for these children. It's really phenomenal. Embedded in that is robust data collection. And so, as you may have noticed, Chosen Quick's data collection ends at discharge. We have very little data on what happens after discharge. And so, through the KICS clinic, we'll have better data directly from the providers of the clinic, but also of the parents, notably of the kin, foster parents, etc., around what is going on with these infants after birth hospital discharge. And then continued supportive services for families at the first year of infancy. And I think this is sort of a general bullet because, as you heard, there are a number of different programs that are looking to expand their services and scope for families when it comes to developmental support, child welfare involvement, et cetera. And so it really is that same theme that I've been harping on around moving outside of the silo, around birth hospital, around healthcare, medical care, recognizing that health and well-being really, to be honest with you, is achieved outside of the hospital and in the communities. So, a few things. If you are interested in learning more about the whole range of perinatal behavioral health related efforts that were highlighted by Katie Breen from CPCQC, here's some information. You can contact CPCQC directly at this email, but honestly, just Google CPCQC, you'll get to their website and lots of information about what's happening and who to contact. Here is that provider survey that Jade mentioned earlier on, healthcare and child welfare. What is it that we know, don't know, and should know? And lots of opportunities to engage and support Colorado. And here's some information about additional policy efforts that Jade highlighted earlier. Finally, I'd like to acknowledge our chosen Quick Steering Committee members that are listed here, many of whom are present today. It is a very active group that engages very often. And while they are listed here within the chosen Quick Steering Committee, all of these individuals are working in multiple different organizations throughout the state related to perinatal substance use. I'd like to acknowledge again the organizations that help support Chosen Quick, School of Medicine, Department of Pediatrics, Illuminate Colorado, and CPCQC. And finally, a huge thank you to Cassie Davis, Rebecca Guili, and Blair Weichel. Round of applause for truly the phenomenal planning down to every detail of this forum that really has made this possible. Lastly, please fill out the feedback and evaluation form. You can scan this QR code. For those that are joining virtually, this is sort of the end of your participation. So please do provide us feedback so we can better plan for the future. If you're in person, there will be snacks outside. You have a break for about 15 minutes. This room will be reconfigured for 3 out of the 4 breakouts, and you'll get more instructions on which area of this meeting facility you should be going to for the breakout sessions. But 3 of them will be in here, and 1 of them will be upstairs. And here are the breakout sessions. If you have not yet signed up, that's okay. You were supposed to sign up when you registered, but if you didn't, just pick one and go. All right. Thanks so much, everyone, for your participation. I hope that you all will stay for the afternoon breakouts.